Roughly 60% of adults in the United States experience lower back pain at one point of their life, and 10 to 12% of the population are seeking treatment for it at any given time, making it one of the most common types of pain. For many, episodes of low back pain are short-lived, resolving with or without treatment in about 6 weeks. But up to a third of those who visit their doctors with back pain may still have pain after 1 year. Anyone can have back pain, but there are factors that increase your risk, such as age. The first episode of lower back pain typically occurs between the ages of 30 and 40. It becomes more common with advancing age. Those who are obese or are not physically fit are also more likely to experience back pain. Having certain diseases, such as various forms of arthritis, can also increase the likelihood of back pain. And having a job that requires heavy lifting, pushing or pulling, and twisting or vibrating the spine can lead to injury and back pain. An inactive desk job may also contribute, especially if you have poor posture or sit in an uncomfortable chair. Smoking increases your risk, possibly by blocking your body's ability to deliver nutrients to the discs of the lower back. Repeated coughing due to heavy smoking may also cause back pain. Smoking can also slow healing, prolonging pain for those with back injuries, back surgery, or broken bones. One of the most common causes of lower back pain is overuse of back muscles. Lifting something too heavy or overstretching can cause a sprain, strain, or spasm in one of the muscles or ligaments in the back. Pain can also result from chronic overuse of specific muscles, such as can occur with scoliosis where the spine is curved and movements favor one side over the other, or if there is a problem with the lower limbs. Weak abdominal muscles and excess abdominal fat can also put a strain on the lower back. Another common cause of lower back pain is a disc that has degenerated or weakened. The tough covering of a disc in the spine can tear, causing pain, and the soft jelly-like interior may bulge out or herniate through the covering, causing more pain when it puts pressure on the spinal nerve root next to it. Sometimes the nerve roots may even be damaged. Where the pain occurs depends on which disc is herniated and which spinal nerve root is affected. The pain is felt along the pathway of the nerve compressed by the herniated disc. For example, a herniated disc commonly causes a type of pain called sciatica. The sciatic nerve runs from the lower spine down the buttock, behind the hip joint and back of the knee, with branches continuing to the foot on each side of the body. Sciatica is pain that occurs when the roots of this nerve are pinched, inflamed, or damaged. It radiates along the length of the nerve to the foot. Sciatica may cause a pins and needles sensation, a nagging ache, or a sharp shooting pain. Numbness may be felt in the leg or foot. Spinal stenosis, a narrowing of the bony canal that contains the spinal cord, predisposes some people to pain related to disc disease. Some people are born with spinal stenosis, but spinal degeneration from disc wear and tear can also lead to narrowing of the spinal canal. A person with spinal degeneration may experience stiffness in the back upon awakening or may feel pain after walking or standing for a long time. Specific diseases or conditions that commonly lead to back pain include osteoarthritis, ankylosing spondylitis, rheumatoid arthritis, osteomyelitis, spondylitis, sacroiliitis, and tumors. Spondylitis refers to chronic back pain and stiffness caused by a severe infection to or inflammation of the spinal joints. Other painful inflammations in the lower back include osteomyelitis, infection in the bones of the spine, and sacroiliitis, inflammation in the sacroiliac joints. Bone spurs, a buildup of calcium on the edges of the vertebrae, or collapsed vertebrae, may also result in back pain. Occasionally, low back pain may indicate a more serious medical problem. Pain accompanied by fever or loss of bowel or bladder control, pain when coughing, and progressive weakness in the legs may be a sign of impending paralysis and should prompt an immediate visit to your doctor. People with diabetes may have severe back pain or pain radiating down their legs related to disease of their nerves called neuropathy. Symptoms of lower back pain can include muscle spasms, cramping, and stiffness. Pain can be made worse by weight-bearing or specific movements, or by forcefully contracting the core muscles of your trunk, such as with a cough, sneeze, or a difficult bowel movement, or if you hold your breath during an activity. Pain may develop quickly or over a longer period of time. It generally occurs in episodes and is often relieved by rest. The most severe pain usually lasts 48 to 72 hours and may be followed by days or weeks of less severe pain. The back is easily re-injured during this period. Pain related to pressure on nerve roots often extends below the knee, starting in the buttock and traveling down the back of the leg as far as the ankle or foot. Nerve-related problems are also indicated by tingling, numbness, or weakness in one leg or in the foot, lower leg, or both legs. Weakness or numbness in both legs, along with loss of bladder and/or bowel control, are symptoms of cauda equina syndrome, which requires immediate medical attention. Depending on the cause, symptoms may be better or worse in various positions, such as bending forward or backward. Symptoms that increase on bending forward are usually relieved by walking, lying down, or other movements that straighten the spine. And symptoms that worsen on standing or walking are usually relieved by sitting down or lying down on your back with your knees bent and by gentle exercises to bend your spine forward. Symptoms of arthritis of the spine generally include pain and stiffness that are worse in the back and hip region. Arthritis pain starts gradually, gets worse over time, and lasts longer than 3 to 6 months. It is generally worse in the morning or after prolonged periods of inactivity. Arthritis pain gets better when you move around. Symptoms caused by arthritis and symptoms due to back injury are often similar and commonly occur together.